Sierra Leone has one of the highest child mortality rates in the world. Here, 1 in 4 children dies before the age of 5, and over 15% of newborns don't survive to celebrate their first birthday. This is Ibrahim. He is 3 years old. Like many children, he likes playing with his cousins and snacking on cassava chips. But here in Sierra Leone, his life could be worth less than 35,000 leones, $12. Ibrahim has been sick for a month, but because his mother Adama is afraid of how much treatment will cost, she doesn't bring him to see a doctor until he begins to pee blood. She gathers all the funds she can, about $12, the equivalent of 1 month's worth of the family's living expenses, and carries Ibrahim, now unconscious, to Sierra Leone's only pediatric hospital. At the hospital, she meets Dr. Karoma, one of the dedicated doctors. Like all her fellow health workers, Dr. Karoma would love to provide free care to patients like Ibrahim, but because of the hospital's dire shortage of even the most essential materials, rubber gloves, gauze, syringes, she must charge Adama a number of fees to cover the cost of her son's treatment. Charging patients is also essential for supplementing these doctors' and nurses' drastically insufficient incomes. The minuscule salaries they are paid by the state are just not big enough to support their families. By now, Adama has only $3 left and has to beg the hospital to give her son a blood transfusion on credit. She still doesn't know if she will have enough money to pay for the other medication Ibrahim desperately needs. Will Adama find anyone to lend her the few dollars that might save her son's life? What will happen to Ibrahim if she doesn't? The Well Body Partnership has been working with Sierra Leone's Ministry of Health and staff at Chrildren Children's Hospital since 2007 to help give children like Ibrahim a better chance. Through the generosity of people like you, we have already achieved a great deal. For the first time in many years, the hospital now has running water and a supply of oxygen. We've begun to provide training for doctors and nurses and facilitated donations of much-needed equipment and supplies. Now, our task is to provide patients like Ibrahim with the free health care they deserve and offer the hospital's doctors the training they need to improve quality of care. With the right partners, we can transform pediatric care in Sierra Leone, starting with this hospital. We can demonstrate that it is possible to provide all children with a better chance at life. To learn more and to find out how you can help, please visit our website at www.wellbodypartnership.org.